You know that feeling, right? The first really nice day of spring hits, and then bam, so does that tickle in your nose. The sneezing starts, then the itchy, watery eyes. We all call it hay fever, but its real name is allergic rhinitis. And, fun fact, it's not a fever and it usually has nothing to do with hay. So let's get into what's really going on with this super common and honestly really misunderstood condition. First things first, let's clear up the biggest confusion out there. Is it allergies or is it a cold? I mean, they can feel so similar. But here's how you can tell the difference. A cold is a virus. It usually brings friends you don't want, like body aches, maybe a little fever, and it hangs around for, 3 to 7 days. Allergies, on the other hand, are a reaction. They hit you almost instantly when you're around a trigger, they don't cause a fever, and they can last for weeks, as long as that trigger's around. Oh, and the other big tell? The nasal discharge is usually thin and watery with allergies, not like the thicker stuff you get with a cold. And this is no small thing. We're talking about a massive global health issue. Allergic rhinitis affects up to 40% of the entire world's population. Just think about that. That's billions of people dealing with the sneezing, the itchy eyes, and just feeling totally miserable because of it. So what is behind this global sneeze fest? In this first part, we're going to break down what's actually causing this allergic overreaction in the first place. It really all boils down to your body's own personal false alarm system. See, your immune system, which is designed to be this amazing bodyguard against real threats, it messes up. It mistakenly flags something totally harmless, like a bit of pollen or dust, as a dangerous invader. And that triggers the whole cascade, the science of the sneeze. So let's get into it. What is actually happening inside your nose to cause all that chaos? It's a pretty fascinating and, a slightly dramatic biological story. Okay, now I know this looks a little complicated, but the story it tells is actually pretty simple. Think of your immune system as a really, really overzealous security guard. The very first time an allergen, say pollen, gets in your nose, that's the sensitization phase on the left. Your body makes these little wanted posters called IgE antibodies and sticks them all over your mast cells. Then the next time that pollen shows up, well, look at the top right, the allergen gets caught and that triggers the immediate reaction. Those mast cells basically just explode, releasing a flood of chemical weapons, and then hours later you can get that late phase reaction down at the bottom, which is what causes that lingering stuffiness that just won't go away. And those chemical weapons I just mentioned, well, here are the main culprits: histamine, leukotrienes, and prostaglandins. These chemicals are directly responsible for all the symptoms we absolutely hate. Histamine, that's what makes you itch and sneeze. Leukotrienes, they're a big reason you get that awful nasal blockage. The key thing to remember is the pollen isn't the real problem. It's your body's completely over-the-top reaction to it. Now, you've probably noticed that not everyone suffers at the same time of year, and that's because there are two main flavors of allergic rhinitis. If your misery shows up every spring with the tree pollen or in the summer with the grass, you've got seasonal allergic rhinitis, classic hay fever. But if you're sneezing and congested all year long, you're probably dealing with perennial allergic rhinitis. That's triggered by indoor culprits that never really go away, like dust mites, mold, or pet dander. All right, so how do we fight back against this biological false alarm? It's time to navigate the treatment maze. And the options really range from just getting some simple relief to actually retraining your immune system. Doctors usually have a pretty standard game plan, a kind of stepped care approach. For mild symptoms that come and go, you'll probably start with a simple antihistamine pill. If that doesn't cut it, or if your symptoms are more constant, the next step, the real go-to, is an intranasal corticosteroid spray. And then for the more moderate to severe cases that are really stubborn, the next level up is often a combination therapy, like using both a nasal steroid and a nasal antihistamine spray at the same time. And this chart is incredibly useful. Think of it as a cheat sheet for figuring out which tool in the toolkit is best for which job. So if your main complaint is nonstop itching and sneezing, oral antihistamines are fantastic. But if it's that blocked up, can't breathe through your nose feeling that's driving you crazy, well, those intranasal corticosteroids are way more effective. And for the itchy, watery eyes, you can go for targeted eye drops or an oral antihistamine for relief. But what if you don't want to just play defense and manage symptoms for the rest of your life? Well, that's where allergy immunotherapy, or AIT, comes into the picture. This isn't just a band-aid, it actually modifies the disease itself. By giving you controlled, repeated doses of the exact thing you're allergic to, either with shots or tablets that dissolve under your tongue, it gradually retrains your immune system to just
chill out, to stop overreacting. It's the only treatment we have that can actually change the course of the allergy itself. But here's the twist. While AIT is a really powerful idea, the science behind it can get, well, complicated. What you're looking at here is a quality check on a bunch of clinical trials for different grass allergy treatments. See all that red and orange? All those question marks and X's? That basically means that a lot of the studies weren't designed or reported as well as they could have been, and that makes it really tough for doctors and patients to compare different treatments head to head to know which one is truly the best. So the science is definitely moving forward, but it's not always a straight line.
So, beyond pills and sprays, what else can you do? This brings us to what should always be your first line of defense, taking control of your environment to just avoid the allergens in the first place. And a lot of these are really simple, practical steps that can make a huge difference. For pollen, try to keep the windows in your house and car closed during peak season. For dust mites, the big ones are washing your bedding in really hot water, like over 140 degrees Fahrenheit, and using those special mite-proof covers on your pillows and mattress. And if you've got a pet you're allergic to, making the bedroom a pet-free zone is a key move. A good HEPA air filter can help with all of these too. It's a fair question, right? With all these advanced medications out there, can something as basic as a face mask or just rinsing your nose with salt water actually do anything meaningful? And the answer is a definitive yes. This quote comes from a 2021 study where they put allergy sufferers in a special room with high pollen levels. The results were crystal clear. Wearing both regular medical masks and FFP2 masks significantly cut down on both nose and eye symptoms. It just works. And it's the same idea for nasal rinsing. Studies show it's a really effective way to physically wash the allergens right out of your nose.
So what's the big takeaway here? There is no single magic bullet. Truly getting control over allergic rhinitis comes down to a three-part strategy. Number 1, avoid the triggers as much as you can. Number 2, use the right medications to control your specific symptoms. And number 3, for those with really persistent and bothersome allergies, consider immunotherapy to treat the underlying disease itself.
And getting a handle on this really, really matters. This isn't just about stopping a runny nose. When it's not controlled, allergic rhinitis can absolutely destroy your sleep, it can tank your productivity at work or school, and maybe most importantly, it's one of the biggest risk factors for developing asthma. The inflammation in your nose is directly connected to inflammation in your lungs.
And that all brings us to the future. Right now, scientists are identifying the specific genes that regulate how our immune system responds to allergens. So I'll leave you with this thought. As we get better and better at mapping our own personal genetics, could the future of allergy care be a totally personalized prescription? A unique immunotherapy designed just for you to retrain your immune system once and for all?